Thank you very much. It's a pleasure to be here. I'm here as well at the invitation of Senator Corbett, and I'm going to veer off from a little bit Councilman Gregory talked about in terms of what someone told me coming in this evening. It's the time to think out of the box in terms of what happens to this hospital in San Leandro. And I think there are lessons to be learned about what we have accomplished and are in the process of finishing at St. Rose. For those of you that don't know, that St. Rose Hospital, which was founded in 1962, was a Catholic hospital up until August of 2005. In 2005, we became an independent, not-for-profit community hospital governed by an 18-member board, all of whom live in Alameda County, most of whom live in either Castro Valley, Hayward, and the Fremont area. The reason we became an independent hospital was we were sponsored by a religious organization out of Wichita, Kansas. And in the mid-90s, a law was passed that required hospitals to do seismic evaluations and to meet certain seismic standards. I can tell you this is a free bit of advice. If you have relatives that live in the Midwest, all you need to do is mention earthquakes, and they'll be on the next plane out of here. And that's exactly what the corporate office, the corporate structure that I work for, decided when that bill was passed. As it turns out, we are able to retrofit our hospital to meet the standard to at least 2030 at a cost of $2 million. 5 years ago, we looked at the process of how do we become an independent community hospital. And that was because the system in Wichita did have a purchaser for St. Rose Hospital, a gentleman from Baton Rouge, Louisiana, who wanted to make it a for-profit hospital and had no experience in actually running a hospital. Our local board members, understanding that the mission of our hospital is to serve our community, and that as a not-for-profit provider, in a sense we are all owned by the community and have a need to respond to our specific community needs. Nancy's already mentioned the planning that we do collaboratively, from which we all draw our plans, service to the community. In order to finance the independence of the hospital, we were required to get intermediate financing. That financing paid the system in Wichita and provided us some working capital. But those loans are due in about another 60 days. It's about $20-some-odd million. Then we approached the Cal Mortgage system in Sacramento. That's an organization that allows a community hospital to access bond financing at very favorable rates. They required two things. Well, they required many things, but two important things. One is we needed to complete that seismic evaluation, and we needed to have contracts that showed the exact cost. We've done that. The other issue we needed to provide, we needed to show that we had a positive bottom line for at least the 3 years prior to that. We've actually had a positive bottom line for the last 7 years. There were some other conditions that made it difficult for us to meet some of their requirements. And that's when, as Nancy talked about, and with David Kears, who's the recently retired County Health Services Agency Director, and someone who really does care about health care and the resources that we have, in particular for those who are most vulnerable, approached Nancy Barber and approached the board of Washington Hospital. And Washington Hospital stepped up because, as Nancy's already explained, we understand the domino effect. If it happens to one, what's the impact on another? And Washington Township Hospital provided a $1.5 million grant that was transferred to the county to access federal dollars, so it actually turned into $4.5 million. Through the support of the county, we were able to go to the Cal Mortgage Financing Division and receive approval. But then they continued to raise a lot of roadblocks. And one individual came to our rescue, a certain Senator Corbett. And Senator Corbett was able to convince the people in Sacramento of the importance of a community hospital. In St. Rose, 49% of the people we see qualify as low income. We are, in a sense, as we say, the safety net of the safety net. The individuals in Central County and the other parts that cannot make it to Highland and Alameda County Medical Center depend on St. Rose. The Board of Supervisors recognized that and has provided tremendous support. And in fact, Supervisor Miley, who was really the father of Measure A that allowed us to access additional dollars through the sales tax measure, has saved Highland Hospital and has gone a long way to save St. Rose. At the end of May, we will finish our financing. There will be a $50 million bond financing. We will use that to repay our existing debt, and we will be adding 30 additional beds to our hospital, completing the seismic retrofitting. And that's still with a hospital that serves 49% low income. We do that because we watch our costs and we work with our community partners. Without Washington Township Hospital, the Eden District, which also provided a grant that was leveraged with federal dollars, we're able to complete this. This is, I think, the unique part of where we are today. Alameda County has a history of having a collaborative planning process. That may not have happened in relationship to the issue at hand today, but I think it can certainly start today. And we can look at more creative solutions than maybe the ones that are on the table today. I'm very proud of the fact that I was the first chair of the Alameda Alliance for Health Governing Board, appointed by the Board of Supervisors. It is an HMO for people that are on the Medicaid program and children that are on the Healthy Families program. And I think you can see, if you talk to most of the doctors and most of the hospitals that take both the Alliance and the state Medi-Cal, that they're much happier with the way the Alliance operates versus the way the state and the federal government operate. The most difficult issue I think we're facing is how you understand how healthcare is financed. And it's financed through the federal government to the state government without much association to how are the counties able to fund their responsibility. It's not, unfortunately, the people at the state or the people in the federal government, but it really comes down to our Board of Supervisors and the County Health Services Agency. I don't have any solutions to offer to you, but I can tell you, as a representative of a community organization that believes its mission is to serve the people who exist in our community, I answer to an 18-member board. They've encouraged our hospital and any leadership that we can assist, any dialogue that we can be a participant in, to look for solutions. There were people that we started 7 or 8 years ago looking at how to change St. Rose from a Catholic-sponsored institution to a community-based secular institution that told us we couldn't do it. Now, there is a light at the end of the tunnel. I'm almost 100% sure it's not someone coming at me. But there are solutions out there, but it does take a long dialogue. The Alameda Alliance for Health, in order to start that, took 3 years of planning in rooms with a lot more people than this in it. And it did that because we allowed the voices to be heard. So I'm just here to tell you that on behalf of St. Rose Hospital, our medical staff, and our board, we're a very willing participant in this opportunity to create a dialogue to come up with a solution that will serve this community. Thank you very much.